Good morning. My name is Jim Farmer. We're going to be talking about drug calculations today. Now, when we talk about drug calculations, obviously this can be very scary since we're actually pushing medication into people's veins. And it can be very scary and we don't really want to cry, so the key to medication administration is practice and organization. And if we do utilize practice and organization every single time, we'll hit the mark and get the gold medal. The first thing we want to talk about today is the metric system. It's not something we generally use in the United States, but it is used across the world when it comes to most things. But here in the United States, we will use this for science and medicine. So of course we have to learn it. We talk about an actual item, a substance, we're talking about milligrams, and 1,000 milligrams equals 1 gram. 1,000 grams equals 1 kilogram. When we talk about volume, we're talking about 1,000 milliliters, or an entire bag full of saline, for example, is going to equal 1 liter. It's important to note that we will also use these two interchangeably, 1 milliliter into 1 cc. So sometimes you might hear somebody talk about, I'm going to go ahead and push 500 cc's worth of a given fluid. We are talking about milliliters. Now, how do we come up with the different numbers and what equals what? Well, in order to do that, we're going to convert from one multiple to another by simply moving the decimal 3 places in whatever direction we need to. Okay? So, for example, we're talking about 1 kilogram. We move that decimal places over 3 to the right, and that's going to be however many kilograms?
1,000.
1,000, good. If we move that 1 gram over 3 spots, how many milligrams is that going to be?
3,000.
1 gram. 1 gram. Janie?
1,000 milligrams.
That's correct. Now, like we talked about, most of the rest of the world uses the metric system, however we don't. When we're talking about patients that are needing a weight-based medicine, the very first thing that we're going to have to do is convert pounds into kilograms. So assuming that we have a patient that weighs 200 pounds, we know from our math and from this particular class that 1 kilogram is equal to 2.2 pounds. So what we're going to do is initially divide the weight in pounds by 2, okay? 200 pounds divided by 2 is going to be 100. But we need to be careful, we're not just quite done, okay? What a lot of people will do in the field, what a lot of people will do in medicine is just stop it right there, and that's inaccurate. We're not done. A 200-pound patient does not weigh 100 kilograms. Unfortunately, through a little bit of laziness, I think, on field personnel part, we just stop it right there and we'll push our meds based on the 100 kilograms. We need to go a step further. We need to multiply by 10, so 100 times 10% equals 10, and then subtract that percentage from the quotient. 100 minus 10 equals 90 kilograms. A 200-pound patient equals 90 kilograms, and that is what our weight-based medicine is on. So just to review, we can do the multiply by 10% to come up with the number that we're going to subtract from the number that we cut in half, or we can just divide whatever our amount is by 2.2. This is going to be especially helpful when we talk about such drugs that we might use in the pre-hospital field, such as etomidate, where our dosage is 0.3 milligrams per kilogram. Okay. So, let's go ahead and talk about medicine for a second. Finding the ordered dose. Well, first of all, we have the physician's order, the amount of medication and the route, the concentration, we'll talk about that here in a second, how much drug is in a given amount of fluid, and we're going to word that as on hand. So if we break it down per milliliter, as an example, we've got 100 milligrams in 5 milliliters. That equals 20 milligrams in 1 milliliter, okay? So what are we looking for? We're looking to identify the milliliters that are to be administered. Now, it's kind of important to note here as well that as we're just learning this, why do we need to figure out what the milliliters are? Why is that important for us? I can tell you why. We can't see the milligrams. We can't actually see the medicine that is in that particular vial. The only thing we can see is the volume, the actual fluid that medicine is contained in. So if all we can see is the fluid, that's the amount that we're going to draw up. Hence, we need to know how many milligrams are in that particular fluid, that preset amount. So we know to draw up that much milliliters in order to push those 20 milligrams. Does that make sense to everybody? All right, so the key is going to be our organization. We need the order, what's on hand, and we're looking for exactly what. So let's find the ordered dose. Dr. Feelgood orders 2 milligrams of Valium IV. You have a 5 milliliter vial that contains 10 milligrams of Valium. So now we know we've got 10 milligrams in 5 milliliters. How many milliliters are you going to draw up in a syringe? Well, we've got the order, and that's 2 milligrams. On hand is going to be 10 milligrams in 5 mils. And we're looking for the actual milliliter that we're going to be given if Dr. Feelgood has this order of 2 milligrams of Valium. So we've got the volume on hand times the ordered dose divided by the concentration equals our volume to be given. 5 milliliters times 2 milligrams, our ordered dose, divided by our concentration, 10 milligrams, equals how much? 5 times 2 is going to be 10. 10 divided by 10 can only go one time, right? 10 divided by 10 equals 1 milliliter. Simple? But Jim, what if I can't remember the formula method? Well, that's no problem. We can go ahead and do the ratio and proportion method. On the left side of the proportion, put your known ratio. 10 milligrams, 5 milliliters. And then on the right side, put the ratio that is unknown. So now we've got 10 milligrams and 5 milliliters on the left side. 2 milligrams, which is the ordered dose, is going to give us however many milliliters. So now we're going to multiply the extremes and then the means. 10x equals 5 times 2. Okay? 10x equals 10. X equals 1 milliliter. Everybody on board? Clear as mud? Good. Titrated drugs. These medications are given in small quantities to produce some form of a desired effect, the dose of which is usually repeated every 3 to 5 minutes, but that's going to depend on your medication. But as an example, you might give 2 to 10 milligrams of Versed for seizure control. You might give 2 to 10 milligrams IV morphine sulfate for pain. Find the units per kilogram. We're going to recognize that the order is based on weight. Key, again, solving this problem is organization. We're going to convert our pounds to kilograms, order by weight to a basic order, and then find our desired dose. So, Mr. Hickey, this one is for you. You are ordered to give 0.3 milligrams per kilogram of etomidate to a 198-pound patient. You have vials containing 30 milligrams in 10 milliliters. How many milliliters will you administer? Let's go ahead and set up our formula. First, we've got the order, which is 0.3 milligrams per kilogram, which will be a part of your standing orders. On hand, you have 30 milligrams in 10 mils, and you're looking for the milliliters. Our patient's weight is 198 pounds. What do you think is the very first thing, Mr. Hickey, that we're going to do? The very first thing?
Divide 198 divided by 2, which is going to be...
Divided by 2?
Yeah. Which equals 99.
Okay.
And then take 10% off that, which is going to be 9. So subtract 9 from 99, it's going to be 90. So 90 kilograms.
Okay, very close. Step 1, converting your pounds to kilogram. 90 kilograms. Convert to a basic order, your ordered dose times your weight in kilograms, divided by 1 kilogram. So we've got 0.3 milligrams times 90, and feel free to go ahead and do the math, divided by 1. X equals 27 milligrams of etomidate that we're going to push to sedate our patient. Then we can also do this using the ratio and proportion method, right? 30 milligrams, 10 mils over on the left side, 27 milligrams equals X mLs. 30x equals 270. 270 divided by 30 equals X. We're going to go ahead and draw 9 mils. Because remember, once we actually get up to the 27 milligrams, we're not done. Remember what I said just a few minutes ago, we can't actually see this medication. The only thing that we can see is the volume. So we're going to have to figure out how much of this fluid, how many cc's, how many milliliters we're going to have to draw up in order to equal that 27. And that's what we just did to come up with 9 milliliters. You understanding, Mr. Catanzaro?
Kind of flying over my head.
We'll go ahead and fix that here in a few minutes. Pretty simple, Ms. Lemire?
I think so.
Good. Concentrations. Find out how many milligrams, micrograms, or grams of a drug there is in 1 milliliter of a solution. It is usually milligrams per milliliters, but not always. Our formula is going to be the solute, grams or milligrams of a drug, divided by the solvent, liters or milliliters. So calculating the concentration using the formula method, 1 gram of Lido has been added to 250 mils of normal saline. What is our concentration? Let's go ahead and organize our information. Set up our formula. 1 gram of Lido divided by 250 mils of D5W. I changed, obviously, saline to D5W. Just roll with it. Convert your grams to milligrams. So 1 gram, remember, equals 1,000 milligrams divided by 250 mils. And now let's do the math. 1,000 milligrams divided by 250 mils equals X. You got 250 divided by 250, that's a 4 to 1. That's going to equal 4 milligrams per milliliter, and that's your concentration. We can also do the same thing using the ratio method. We got 1,000 milligrams and 250 mils. We're going to place our unknown concentration on the right and our known on the left. And then once we multiply the means and extremes, 250x equals 1,000. How many times does 250 go into 1,000? 4. There's your concentration. Hang on a second, we're not done. I got to give you some more medicine. Let's go ahead and calculate some IV drip rates. We're going to determine how many drops per minute are needed to infuse a desired volume of an IV solution over a given period of time. So in other words, how many drops per minute are needed to infuse 1,000 milliliters of normal saline over 2 hours using a macro IV set. The formula we're going to use for this is quite simple. Volume to be infused divided by the infusion time in minutes, and we're going to times the sum of that to your drip rate set. I'll show you here more on this next slide. Dr. I.V. Hurton orders 2 liters of D5W and half normal saline to be infused over a period of 4 hours. Using a macro tube drip set of 15 drops per milliliter, how many drops per minute will you adjust your IV set to the liver? So let's go ahead and set up our formula. The formula is, and try to keep the 15 over here on the side just a bit, 2,000 liters divided by 4 hours, and you're going to times the sum of that by 15. Convert to proper units and solve. Do you think we're going to be able to divide into hours? Remember, we're trying to figure out how many drops per minute. So what are we going to have to do with the hours?
Convert it to minutes.
Convert that to minutes, that's correct. What about the liters? Are we going to have to convert that as well?
Yes.
Yes, absolutely. So we want 2,000 milliliters divided by 240 minutes times your drip set per milliliter. In this case, we're using a 15. And that's going to equal 125 drops per minute. So quite simply, all we're doing is we're dividing that 2,000 milliliters into 240 minutes, taking the sum of that and timesing that by the 15 drops per milliliter set. And that's going to give us 125 drops per minute. Now, in a practical sense, Tim Hickey, what does that mean? 125 drops per minute. So you have an IV bag, and you have a drip set. What does 125 drops per minute mean to you? What are you going to need to do?
Divide that by 60.
No, you're not going to. I don't want you to divide anything. I want you to tell me exactly what you would do in order to get 125 drops per minute if you were looking at that drip chamber.
2 drops a second.
Approximately, yeah. That's exactly what you're going to do. And that's going to give you that 2 liters over a period of 4 hours. Well done. And I think right there is where we will go ahead and stop. And we're going to go ahead and call a couple of you guys up to practice some of these. So Tim, why don't you go ahead and go up on the dry erase board for me, please. You can go ahead and take your calculator with you. You have your calculator?
No.
Okay, you can go ahead and take your calculator with you.
Okay.
Okay, are you ready?
Yep.
All right. Let me get to where I'm ready. So let's go ahead and do some drip sets first. You have 2,000 milliliters of lactated ringers to be infused over 16 hours. Your drip set is a 10 drop per milliliter set. Okay, so let's go ahead and organize our information.
Okay.
So go ahead and put 2,000. You've already got the 2,000. Well, that'll work too. Now draw a line underneath. Okay, and we're going to convert that into, we're going to convert the 16 hours that you're going to write underneath there into minutes.
260 minutes.
Correct. Okay, so then off to the side, what I want you to do, let's go ahead and erase this, and we're using a 10-drop set, right?
Yep.
So, 2,000 milliliters divided by your minutes times your drip set. So first go down and do that, then take your sum and multiply that by your drip set for your answer, okay?